Let's chat more about this now with the South African Medical Research Council CEO, Dr. Glenda Gray. Dr. Gray, good morning, and thanks so much for your time. Just listening to what Anban Pillay had to say there, it sounds, just what he's saying, that this 14,000 or just over 14,000 is at least the number of infections. It definitely is much higher than what we're looking at the moment. Just how worried should we be right now?
Yeah, it's the tip of the iceberg because we're not testing everybody in the country. And so we should be very worried. This is a second wave, and the wave is being fueled by this new variant. And the new variant seems to be much more infectious, which means that the transmission rate is going to be faster, and we're going to infect more people faster. And that is why we have to wear our masks, we have to have our physical distancing, and we have to sanitize our hands. We have to avoid congestion, and we have to make sure we're always in open ventilation. Ventilation is critical. We need ventilation at all times, particularly when you are in crowds. So we are very worried. 14,000 infections is the tip of the iceberg, and it could be a lot worse.
Well, just explain to us then what we know at this stage about this new variant, Doc. I mean, have we identified the actual traits of it? Yes, we hear, like we heard from Anban and like we heard from Dr. Zweli Mkhize as well, talking about how it has the ability to sort of spread exponentially, how it seems to be more difficult for the body to actually fight this off. What do we actually know about the characteristics of this variant?
Okay, this variant is called 501YV2. It's similar to the variant that's been found in the UK that's also spreading and is a dominant variant in the UK, and is what's caused the UK to be locked down. This mutation is found in the receptor binding domain, which is on the spike protein. So we need the spike protein to attach itself onto the ACE2 receptors in our bodies. And this variant that's found in that area makes the virus more able to bind onto our receptor sites, our ACE2 receptors. It's got three other variants where we found this new lineage. It's the K417N, the E484K, and the N501Y, which is what we've been talking about a lot, and the 501 that's been found in the UK. So there are three parts to this. It's all on the binding domain, and that's of concern to us because it makes transmissibility much more easier.
How does something like this actually mutate? What causes such a mutation? I mean, did it infect somebody who had a particular gene and they mutated it and passed it on? Somebody who had something in their system that could? How does this actually work? How does it happen?
So viruses mutate all the time under immune pressure from people. And there are a lot of hypotheses about why this happened. It could have been, this person could have been chronically infected. This person could have had other comorbidities, and passing this mutation on to another person who's also chronically infected. And so there are lots of ways that viruses evolve, but they usually evolve under immune pressure from human beings. So we do expect this to happen. Virus has evolved slowly over time, and not as rapidly as we see in influenza and not as rapidly as we see in HIV, but there is evidence the immune pressure that humans exert on this virus will make it change and evolve.
So, Doc, the UK saying that this variant has come from South Africa. We just heard the clip there talking about cases that have been identified among travellers as well, but that's being disputed by a professor in KZN. So how do we actually determine where this might have originated? Is there any way we can actually determine, not that we want to blame or figure out who's responsible for it, but it would be very interesting to figure out where this came from and what the peculiarities of that may be?
Yeah, I think that so our mutant our variation was found in Nelson Mandela Bay. But if you're not, wherever you are in the world, if you have the same host characteristics and the same kind of system, you may find that the virus might normally evolve in that way. So it's not a specific place. It's just the characteristics of immune responses. And so if we all have the same HLA background, and the virus evolves under certain immune pressure, you may find that evolution might happen in any part of the world. And if you're not looking for it, you may not find it. But certainly, we have one, and the UK has a similar one, which suggests that there are probably other parts of the world that have similar mutations as well.
So what are the implications of this now for the vaccine, Doc? I mean, everybody was sort of getting a little excited, saying, okay, we're seeing this working, we're seeing it being used on people already. This new variant now, does it render that vaccine actually useless? What do we actually do with this new information in terms of a vaccine?
So that's an important question. So fortunately, the spike protein on which we make our vaccines is big. And these are only small portions, small amino acid changes on a very big spike protein. And so we will be evaluating whether these variations will impact on vaccine efficacy. But we don't think so because of the bigness of the spike protein. We also know that the immune response to the spike protein is very large and quite and in depth. So we don't think that a few mutations will affect the vaccine at all. But it's very important to check. And obviously, the more the virus evolves, the more we have to evaluate whether it is impacting on our vaccine design. We heard yesterday that the people that made the Pfizer vaccine, they would be able, if new strains arose, they could easily replace the current vaccines, immunogens, with something else. So it's not something that we are worried about now, but over time, this virus might evolve even further, and we may be in a situation where we would have to every so often alter the immunogens in the vaccine to make sure that it's identical to the circulating strain at that time.
This new variant, though, does it render groups that we never thought were vulnerable or susceptible before from the start of this pandemic, does it render different groups susceptible and more vulnerable? For example, the youth, and children who we thought were not going to battle so much, even if they had it, or they could fight it off better. Does this new variant change all of that as well?
So it's very important to evaluate. So a group of scientists met yesterday to ask all these questions. We've divided the questions into a couple of frames. We want to see what the clinical impact is of this virus on infections. We also want to see what the virological and immunological assessments are of this new strain. And we also want to make sure that we want to understand whether it makes younger people more ill and what impact it has on older people. So those are all very important questions, and we can't answer that at the moment. But we are working very hard to try and answer that in the next couple of weeks.
Yeah, I understand it is still early days. Thanks there, Dr. Gray. But we're also hearing that government is now looking at harder new lockdown restrictions as well. Many people feeling that this should have been done weeks ago. We should have not had interprovincial travel. We should never have opened our borders as well. So what would be the right thing to do at this stage? Would it be wise to take us up a couple of levels when it comes to lockdown now again?
Okay, the response is in our hands. If we are adherent to the non-pharmaceutical interventions and we are mindful of spread, spread is spread by people. And the only way we can stop the spread is for ourselves as responsible citizens is to wear our masks, wash our hands, keep our distance, and make sure that we don't hang around in overcrowded places. And so it's all in our hands. If we get COVID and we spread it to elderly people or people with comorbidities, they may die. And so it's up to us to try and protect the vulnerable people in our society. So the outcome all depends on us. And we have to try and make sure we as human beings prevent onward transmission and protect the elderly and the vulnerable, because this is a terrible place to be. Our healthcare workers are sick, they're tired, they're fatigued. Our hospitals are being run over for people who are sick. We're running out of oxygen. We have to stop this, and the only people that can stop it is ourselves.
And Doc, just a final question. When I think about people who've been traveling interprovincially, we see what's happening in other provinces, whether beaches are closed or not. There's always still the danger there. It causes a bit of panic for me when I think about everybody going back to their home provinces, going back to their suburbs, going back to their townships, wherever it might be. Are we particularly worried about that time after New Year when we're going to see everybody going back? And what do we do about that? Because for me, that seems like a bit of a red flag, or a big red flag.
Yes, I think we're very worried. We just heard about the deaths at the border posts, people going into other countries. We could spread this virus into other countries in Africa, and also we can spread it to places where people haven't been exposed before. And so, of course, this is of a huge worry to us. And you have to try and balance the whole issue of keeping a society open, but at the same time being mindful of reducing the spread. And we have to find that balance. We have to find a balance where we can control the onward transmission of the virus, as well as keeping the economy open. And that's a very important balance that we have to get. And we also have to get the vaccine, because without the vaccine, it's going to be very hard for us to try and tackle these outbreaks that we may see from time to time.
All right, Dr. Glenda Gray, thank you so much. Certainly reinforcing that it certainly isn't a time to rest. It's not a time to let your guard down. It's actually, you need to up the ante as of today. Well,